Zorlukları geçtin, yeni evine hoş geldin.
This is the place to find yourself.
Istanbul offers great universities and the lifestyle is really amazing here.
So I live at the dorms at Maltepe University and I'm really happy with it. There's a cleaning service every few days and then there's the library nearby which is open 24/7.
My first impression when I came was like, it's huge. You have everything in one place.
When you first come to Maltepe University, you don't know where what is and you're like, oh my God, I need help. Guess what? You're not alone. There is the international office people over there. They're like family. They're very helpful and they're always there for you.
Istanbul is the perfect mixture between ancient and modern. Coming into this city helps me discover myself, learn about so many different cultures, learning about the world, which will help me in writing future books.
At Maltepe University, we have a lot of research centers. Because of that, we have the ability to participate in a lot of international projects.
Here at Maltepe University, the education consists of both practical and theoretical. We get the opportunity to practice everything we learn in class in real life. So after we graduate, we have a degree and we can work all over the world.
People come to Istanbul all the time, but what they really miss when they visit are the antique shops, which contain thousands of years of memories and also a thread of the modern future.
I like to use every minute and just get out and hop on the ferry and just go from the Asian side to the European side and just enjoy the wonderful weather with the wonderful Bosphorus behind me and just enjoying the moment of Istanbul.
Istanbul is very beautiful with great culture.
This city is the symbol of diversity. Come and study at Maltepe University.
Come here and feel like you're home.
Hello everyone, I'm Melike Çağlar. I will be a moderator for this section. Our participants will present about treatment, diagnosis, and clinical aspect in COVID-19 again. For the first presentation, I invite İrem Nida Tronalp to present her study titled COVID-19 Drugs and Drug Repositioning.
Hello, Melike. Thank you. Today, I will be presenting Melike. Melike, can you see me? Okay. Hello, everyone. I'm İrem Nida Tronalp, and I'm a third grade medical student at Maltepe University, and I'm from Turkey. Today, I will be presenting COVID-19 drugs and drug repositioning. The COVID-19 pandemic is caused by SARS-CoV-2. Drug repositioning is a precocious field in the development and discovery of therapeutic agents that distinguishes new therapeutic options for existing drugs, and there are repositioned drugs in COVID-19 treatment. This is a diagram to compare the drug development types, which are the traditional pathway and drug repositioning, as known as drug repurposing. In de novo drug discovery, also known as the traditional pathway, the first step is target discovery, and the following steps are screening, lead optimization, admit, development, and registration. In the drug repositioning, the steps are compound identification, compound acquisition, development, and registration. Compared to the traditional pathway, the drug repositioning takes less time, it is cheaper, and we need less safety data. We aim to explore repositioned drugs for COVID-19 pharmacotherapy. We further classify the drugs according to ATC-DDD pharmacological category, which is an international classification method to determine national standard for medicinal products, and it also assists procurement agencies. Drugs are retrieved from the NIH guideline and national guideline. NIH and Turkish national guidelines are compared for treatment approaches. While I was preparing my presentation, the Turkish National Guideline has been updated. I prepared my presentation on May 5th, and the Turkish National Guideline has been changed on May 7th, which shows the dynamism of this process. Remdesivir, hydroxychloroquine, lopinavir, ritonavir, favipiravir, and interferon regimens are found to be repurposed in clinical guidelines. These are some previously approved antiviral drugs, and remdesivir is the only FDA-approved one. It is used parenteral on COVID-19 treatment. The availability of the drugs depend on the accessibility of the countries. These drugs are presented on the national guidelines, and in our national guideline, in Turkish national guideline, favipiravir is the only presented drug. This is the ATC classification table, and each letter represents a group. Hydroxychloroquine is in P01BA group, which is the antiparasitic products, insecticides, and repellents group. Lopinavir, ritonavir, and also favipiravir is in J05AX group, which is the anti-infective for systemic use group. And interferons are in L03AB group, which L represents the anti-neoplastic and immunomodulating agents. A recent study obtained 21 pre-existing drugs which are effectual at blocking SARS-CoV-2 viral replication. 2 of them are already FDA approved, which are astamazole and clofazimine. 13 of them have been clinically tested and have proved the effectiveness against SARS-CoV-2. 4 of them have shown that they work synergistically with remdesivir. Remdesivir and corticosteroids are currently recommended by NIH to the hospitalized patients with COVID-19 for their treatment. Besides corticosteroids, some antithrombotic agents are being used in the treatment of COVID-19. And every day, the number of the clinical trials increases, and they are in progress, as Sevda mentioned in her previous presentation. The results of these clinical trials are affected as the virus mutates, so it's a changeable and progressive state. These are my references. Thank you.
Thanks to İrem Nida Troner for the good information. Now, we will continue with impact of COVID-19 on the outcome of pregnancy presentation. The presenter is Felak Tarin.
Can you share my screen? Hello? Can you hear me?
Yes, we can hear your screen and your voice.
Yeah, thank you.
Can you start?
Okay. A very good afternoon, everyone. I'm Falak Tareen, and I'm a fourth course medical student at Chris State Medical Academy, Kyrgyzstan, and I'm here to present my research on impact of COVID on the outcome of pregnancy. Next slide, please. Next slide, please. No. Yeah. My research goes around the Aga Sayyid Yusuf Rahmatullahi Alayhi Memorial Hospital. Can you please move the slide back? Yeah. My research goes around the Aga Sayyid Yusuf Rahmatullahi Alayhi Memorial Hospital. It is located in the district Badgam region in Jammu and Kashmir, which is a state in India. This area has a population of about 753,000. Next slide, please. Yeah, my research goes around 3 main keywords. First being the social distancing, which is a very important factor in the COVID-19 pandemic region, which led to home isolation because most of the pregnant women were asked to home isolate themselves in order to minimize the risk of catching the virus for them, which led to reduced outpatient visits for the doctors, because doctors operated most of the cases over their phone calls or video calls. The purpose of work is to study the course of pregnancy and childbirth during the COVID-19 pandemic at the Badgam District Hospital, Kashmir State, India. Next, please. Next slide. Yeah. My research goes around the comparative analysis between two groups. First being the main group, which included the number of pregnancies recorded during the COVID-19 pandemic, which was from May to July 2020. And the second group being the control group, in which pregnancies recorded were from May to July 2019. The retrospecifically analysis between the birth histories were made and were recorded. The number of birth histories in the main group were 3,300, and the number of birth histories recorded in the control group were to be 3,320. Next slide, please. Yeah, as you can see from the graph, we took into consideration women of 30 to 35 years, which were about 75% of the total cases registered. After that is women from 25 to 30 years, which were around 20% of the total cases affected. And lastly, we took 35 to 40 years, which were around 5% of the total cases. The incidence of COVID-19 happening at the Badgam District Hospital, in which the positive cases came to be 3% of the total cases which were analyzed, and the patients were either symptomatic clinically or with laboratory diagnosed COVID-19. Next slide, please. Yeah. Now I shall be explaining to you. As you can see from the graph, we have compared two main groups. Like I already said, the main group and the control group. The main group has been depicted by the color red, and the control group, it has been depicted by the color green. We took into consideration, when we considered the amount of complication, we saw that the premature rupture of amniotic fluid cases, they rose for about 25% as compared to the previous year in the control group, which was around 17% in the previous year. Then the preterm cases, they also increased up to 25% when they were recorded in May to July 2020, and earlier they were 13%. Similarly, diseases of the urinary tract system were 14%. Earlier they were 10%. And lastly, the preeclampsia cases, they were recorded to be 8%, and previously they were only recorded to be 5% in the previous year, that is May to June 2019. Next, please. Yeah. As we can see that most of the COVID cases, which were the incident of COVID-19, like we can see, it has retrospecifically, it had a significant impact on pregnant, parturient, and post-parturient women, and the preterm cases, and also like the pregnancy complication, which rose to an increasing amount rather than the previous year. As you can see, like I explained, the complications like premature rupture of amniotic fluid and preeclampsia, which is severe. Next slide, please. Yeah, like I was talking about the negative aspects of lockdown. Let's take a look on the positive aspects of lockdowns as well. The good news is that the vaccinations have already begun in all over the world. The countries have started to put vaccines around all of the countries. Secondly, the elderly care patients, they are being given more care rather than earlier, because they are at a higher risk of getting the virus. Thirdly, the hygiene norms, they have been increased a lot as compared to previously. Lastly and leastly, the teamwork of the doctors have increased to such a level that they have united to fight against the virus globally. Next slide, please. That was all. Thank you for your attention. Thanks a lot. Hello.
Next presentation, Ms. Tari. Next presentation is Students' Eyesight Features and Changes During Remote Studies, introducing Ms. Emilia.
Hello, everyone. My name is Emilia Kejavichute, and I am a second-year medicine student from Vilnius University. Today, I will be presenting a study, Students' Eyesight Features and Changes During Remote Studies, that I have conducted with the supervision of Associate Professor Dr. Valeria Yablonskina. To begin with, the background of the study was to gather more information about the changes made by students due to remote studies and to consider the effects to the vision that these changes might cause. As we all know, during the COVID-19 pandemic, there was a significant shift in the everyday life and work habits of students. So in order to prevent the rapid spread of the virus, all university programs have been transferred online. That resulted a great change in students' lifestyle and daily habits. So the aim of the study was to evaluate these lifestyle changes and to take into account the ways that they can cause eye damage now or later on in the future. To do so, a survey was conducted with 126 participants. All of these participants were students currently undergoing their education process in the circumstances of remote studies. They were asked about their lifestyle changes, differences in eyesight, and new symptoms noticed since the beginning of remote studies. Also, the measures to preserve eyesight were taken into account, and based on recent studies about eye health, speculations about long-term effects were also made. The survey conducted that since the beginning of remote work, the majority of students have experienced at least some form of negative eye symptoms. 31.8% of the students noticed reduced eyesight, 69.8 reported have felt dryness, 78.6 eye soreness, 85.7 eye tension. Also, symptoms such as redness and blurriness were reported. Although there can be many variables that can cause these symptoms, there are a few significant factors that can be the cause. To begin with, one of the most prevalent risk factors during remote studies is prolonged screen time. 100% of the respondents have reported that their screen time has increased significantly during the remote studies. The average time spent working at a computer was 8.4 hours per day. This trend of prolonged exposure to screens is seen not only in our study, but in similar studies that have been made that tested students' eye health. For example, Bakir et al. Study that had 407 participants average 8.64 hours per day of screen time. The screen time factor can lead to computer vision syndrome. Currently, it is not a well-known disease among students, but it is estimated that it affects as many as about 60 million people in the world right now. Computer vision syndrome may cause eye tiredness, sensitivity to light, dryness, and pain. Another great risk of increased screen time is its ability to boost myopia development and progression. Although 55.6% of our survey participants already had myopia, more than 30% of healthy students and those who had myopia already answered that during remote studies, their vision has decreased. It is consistent with the newest literature about myopia development, and it is predicted that myopia prevalence may skyrocket due to increased exposure to screens. It is found that myopia is more common in well-populated urban regions and are more prevalent in groups of people that have higher levels of education. But there are speculations that this probable exponential growth of myopia prevalence that is often regarded as quarantine myopia may increase the prevalence of myopia to as high as 50% of the population by the year 2050, even in the regions of the world that had previously had lesser amounts of myopia cases. Not only that, there are factors indicating that myopia can increase the odds of developing more serious eye diseases, such as glaucoma, later on in life. The prolonged screen time effects may be mitigated by doing regular work breaks and eye exercises. It is recommended to have regular breaks away from the computer and to perform eye exercises, although only 11% of our respondents said to have regular breaks, and only 3% of them regularly completed eye exercises. A simple formula for eye protection is called the 20-20-20 rule, that every 20 minutes a 20-second break is taken, where a person looks into the distance of 20 feet, that is about 6 meters. Secondly, it was noted that a significant decrease of physical activity that was reported by 78.6% of the respondents may negatively impact eyesight due to reduced perfusion. It may also be a determining factor in the development of myopia and other negative eye symptoms. It is noted that physical activity of any intensity that lasts less than 3 hours per week is likely to not only increase, but to even double the risk of developing myopia later on in life. This again can be explained with a decrease of eye perfusion, because during physical exercise, eye perfusion can increase to as much as 190% of the usual amount. Without exercise and with inevitably reduced perfusion, this may lead to myopia development later on. It is also noteworthy to take into account the time spent outdoors in the fresh air, as it also had an impact in myopia development. On average, an increase of 30 minutes outdoor every day may have a good impact on eye symptoms and reduce myopia development. If an increase of outdoor time is not possible due to COVID regulation or other personal reasons, there are still preventative measures to take. Even an increase of air quality in the workspace may help lessen the negative eye impact. Constant room ventilations, air purifiers, humidifiers may reduce eye dryness and help maintain eye comfort. It is proven to lessen eye dryness, tiredness, and help the overall good feeling in the eyes and reduce the negative symptoms. Although these measures are not prevalent among students, with as little as 4.7% of all students using air quality enhancing efforts. So to conclude, it is obvious that remote studies have affected the way that all students learn. It has increased the time spent working with a computer, reduced time spent outdoors or exercising, and thus increasing the chances of developing myopia and computer vision syndrome. As well as that, it has also significantly increased the prevalence of day-to-day negative eye symptoms such as tension, tiredness, and dryness. It is important to shed light on this topic to educate students and their places of study and find ways to encourage students to take measures of protection to help their eyesight, such as regular breaks using the 20-20-20 rule, enforcing regular exercise, and time spent outdoors. Specially designated workspaces with good air quality may also help eye health. All these measures, when taken simultaneously, may help reduce the possible influx of myopia cases worldwide and improve the overall student health. So thank you all for the attention.
Thank you, Ms. Emilia, for the valuable information. Fourth presenter of this section is Dimitri Kolesnik. He will talk about attitude and behavior of medical students toward vaccination against SARS-CoV-2.
Hello, all the presents. Do you see screen? Yeah.
Yes, we can see. You can start.
Okay, thank you. Okay, let me tell you about attitude and behavior of medical students towards vaccination against SARS-CoV-2. In condition of severe acute respiratory syndrome, SARS-CoV-2 pandemic, lockdown, distant learning, anxiety, and fear of the virus, the rate of psychological deviation increased significantly. The current public debate on vaccination against coronavirus infection is a good opportunity to assess students' attitude and behavior towards vaccination. To evaluate the results of a survey of medical students on the current state of knowledge about vaccination and their readiness to be vaccinated against the SARS-CoV-2 virus. Methods. With the help of Google Forms, an online survey of students studying at Bukovina State Medical University was conducted in January-February 2021, before the introduction of vaccination in Ukraine. Confidentiality and anonymity were clearly maintained, as confirmed by the University Bioethics Commission. Questionnaire with phone calling, messages, email, and tasks. Is a Google Forms which we create. Of the 958 medical students surveyed, the largest share were students majoring in medicine. The number 703 is 73.4%. Among other specialties, dentistry, the number 123 is 12.8%. Pharmacy, 126 is 13.2%. Nursing is 80 is 8.4%. Pediatrics is the number 49 is 5.1%. Their average age of the students was 22.3 plus or minus 1.2 years. The ratio of boys to girls was 1 to 1.4. The frequency of testing for SARS-CoV-2 was the same among all several participants and averaged 24.5 persons, with positive results in 8.9% of the cases. To the questions, have you been vaccinated as a child according to the vaccination schedule for mild childhood infection? 854 is 89.1% students answered positively. Slightly more than half of the respondents, the number 554 is 57.8% are ready to be vaccinated against SARS-CoV-2, of which 254 are ready to be vaccinated, while 120 is 21% answered that they can be vaccinated in the presence of the vaccine double administration. 98 is 17.7% under certain epidemiological circumstances, and 82 is 14.8% think that probably in the future could be vaccinated. The vast majority of respondents who were ready to be vaccinated against SARS-CoV-2 were students of 4 to 6 years of study. 454 is 78.3%. Among those who refused to vaccinate, the most students were of the first years of study. Out of 404 respondents, 312 is 77.2%. The respondents are more concerned about the complications that might occur after vaccination. To the question how much they worry about the side effects of vaccination on a scale of 0 to 5, a third of students choose the number 5. Aim on the possible complication named by the respondents in the first place is a hypersensitivity reaction. The number 93 is 9.7%. In the second, the fever and malaise. The number 80 is 8.3%. In the third, long-terminal consequences. The number 76 is 7.9%. Local reaction, swelling or redness, autism, microchipping, restriction of right were distributed with equal frequency. Conclusion: the majority of students who took part in the survey reported their readiness to be vaccinated against the SARS-CoV-2 virus. Thank you for your attention. Be healthy.
Thank you for this great study, Mr. Kolesnik. Now I invite Shoaib Mohammed. The title is Type of Vaccines, Tackling Vaccine Hesitancy and Improving Immunization Delivery. We can see your screen. You can start anytime.
Sure. Okay, hello. My name is Shoaib Mohammed, and I'm originally from Pakistan, but right now I'm studying at Darpal State Medical University in the third course medicine. So my present study aims to uh, tell about the vaccine hesitancy and all the possible complications while a physician faces once he tries to inoculate the patient. So it was, as you know, everybody knows that COVID hysteria is going on nowadays. That's why it was a bit difficult to communicate directly to the patients. So that's why a Google form was created, and it was like Google form consisted of different questions, and they were asked about the nationality, about their ages, and their profession. So I will try to share the questionnaire with some of my results I got. So but prior to that, I would like to tell like what kind of like nationalities and people were discussed. Like there were most of the people from like Russian Federation, and of course Pakistan, my native country, Indian people, Egyptians, and their ages varied from 18 to 55. As I told, like there was a direct communication was difficult. That's why we used Google Forms. So if we talk about the age value, like the people from the age of like 25 to 30, they supported vaccination because like as there were more ratio of like education in those people. So that's why they supported vaccination, and but they also suggested some other alternative routes. And then genders, like females, about 60.5% of people were like males, and you can say like 2.6% people were females. So nationalities, as I expressed. So the first question we asked, like there was, how many people were vaccinated in childhood? and we got the 81.6% people who already got vaccinated during childhood, and they supported vaccination. And about you can say 13%, 13.2 people didn't remember whether they got vaccinated or not, but they supported vaccination, and as you know, it led towards the treatment of specific like COVID. Okay. And there was another question we added in our questionnaire, like what was the intensity of pain they guys like when people feel when they get inoculation of vaccination. So we got the results. About 68.4 people claimed the intensity of pain 1 to 3. So that means these are also the people who supported the most idea of vaccination, and they supported that there must be vaccination. And 21.1% people, they felt the intensity of pain during vaccination, that was 4 to 6. And it was also a good they also said it has to be like vaccination should be priority, but there must be vaccination, but uh, priority should be given to the oral medicines. So next, and yeah, there are a lot of people who showed some sort of phobias, and this question was also included, also the part of our research. And more about 15.8% people showed the phobia of injections, like whom we call cryophobia. And they didn't support vaccination, but they preferred to take the medicine of other than vaccination. So, and there were about 94.7% of people were like they didn't had any disease, but out of 100%, they said they claim that there must be vaccination, and vaccination must be supported at any level. But if there is some sort of disease, somebody suffering from disease, there has to be a proper counseling to the patient, like why he's going to be vaccinated, and he must be told about the benefits of vaccination. So about 73% of people like the medicines in the injected forms. Why was it so? Because since childhood, it becomes a very routine as we pass through the different vaccinations like polio, and some other flu shots. So about 73% 0.7% of people claim like there must be vaccination, and but they preferred the oral medication. So that's why there 73.7% of people preferred oral medication, but they also said there must be vaccination because they become so habitual to the since their childhood. So yeah, and there are like a lot of people, if we see in the families, there are a lot of people who have emotional attachment with siblings or family members. So they showed like they resisted vaccination, and the ratio of those people was 68.4, and 21.1 people they get emotional, or they have phobia of getting vaccination, or they don't suggest vaccination to someone who's already getting it. So, and there was also, and it was very positive response. Like about 38 people said, like 89.5% of people said uh, they already got vaccination for polio, like in the since their childhood, and they also supported the idea of getting vaccinated. Okay, and there was trust related questions which we asked, what healthcare professional people normally trust to get vaccinated, and most of the people showed trust on doctor, and about 20% showed trust to get vaccinated by pharmacist, and about 10% of the people, they claim that they are comfortable to be vaccinated by the nurse. So this was the research. Now I'll just try to conclusion. So first of all, a non-invasive vaccination system should be developed. Like, of course, as there were people who felt pain while being vaccinated. That's why, like, there must be some non-invasive system of vaccination, or not vaccination, but non-invasive system should be there to treat specific disease, or no matter if it's a COVID issue, if it's a coronavirus issue. So there must also be the dosage forms that are easy to engulf without any invasion or to the body. Next, there was, as healthcare professionals is also part of this research, they also suggested, like, there must be a good relationship among a pharmacist and a doctor and other healthcare professional. Why? Because pharmacists craft the dose. That's why they should work in association with doctors to craft the good medicine that are like, that must not be invasive. There must be no puncture to skin, so that they can create such dosage forms. So the doctor, and especially doctor and pharmacist collaboration, is very much thing once it comes to craft the new dosage forms. Then there are other routes of administration, like vaccination, or maybe as their WHO organized recently, the oral vaccines, or inoculation of drugs or medicines with the nasal or pulmonary routes. And the one aspect, like in our healthcare system, we also got this point, like most of the healthcare professionals, they should have good communication skills for the to deliver the maximum knowledge to the patient about letting them know the possible ways or possible benefits of getting vaccination. So if a physician or a good clinician, he has good communication skills and a grip on knowledge, so he must be like, he's very easy to take the patient in their confidence, so that he can like deliver the medication or the vaccination. And vaccination must be taught at every stage of the school. So here is pharmaceutical technology. There was also a suggestion from one of our pharmacist student. He said, like, the pharmaceutical technology emphasizes on crafting of good dosage forms that are easy to be engulfed. So if doctor prefer this technology, so it's easy to make the less invasive, more comfortably engulfing dosage forms. And there are some vaccine patches that can also be used for those patients who are like cryophobic, who have phobia of any injection, or if they have any sort of hesitancy or hypersensitivity, so they can use the vaccination patches. And then we have if patient counseling is done good, so then definitely the disease treating outcome can be better. Thank you so much for listening to me.
Thanks for this presentation, Mr. Mohammed. I invite the last speaker of this section, Ms. Tamara Tanevska, to present their study titled The Participation of Medical Students in Prevention of COVID-19 in the Republic of North Macedonia.
Thank you, Ms. Melike. I hope you can hear me, yes?
Yes, we can hear and see your screen.
Okay, thank you. First of all, let me introduce myself. I am Tamara Danevska, and I come from the St. Cyril and Methodius University in Skopje, Faculty of Medicine. Today, me and my colleagues are going to present you for the participation of medical students in prevention of COVID-19 in the Republic of North Macedonia. My colleagues and I, Jansun Bukovec and Ivana Stojanovska, did this paper on our own experience and would like to present you with you. So first of all, let me start with the evolution of active cases in North Macedonia. As seen on the diagram above, the number of total active cases was rising, and our country faced a peak of epidemic starting from October to mid-December. And after that, the active COVID-19 cases, the number of active COVID-19 cases were steadily decreasing. Some statistics about the COVID-19 epidemics in North Macedonia. On the 25th of January, we had registered 420 active cases per 100,000 inhabitants, and we had 91,555 cases in total. Because of that, the healthcare system collapsed, and in September 2020, the results were late up to 10 days. Because of that, epidemiologists could not achieve the given large number of questionnaires. So I would like to say that the epidemiologists in our country are in deficit, and most of them are before retirement. So only one epidemiologist was taking care for a whole area of 2 or 3 cities. And because of that, there was a shortage of staff who could survey the positive cases and put them timely in isolation. So we thought that it was time to change, and us as the 6th-year general medicine student, since the beginning of this pandemic, we wanted to contribute to the fight against COVID-19 in our country. And because of that, the medical faculty in Skopje and the Ministry of Health decided to invite us to get involved in the fight against COVID-19. This outbreak put a lot of pressure on the healthcare system and health workers in particular. And in order to gain the trust of the patients, it was necessary to ensure good communication with them. So any patient diagnosed with COVID-19 needed to be contacted by an epidemiologist as soon as possible to find out how they become infected and to ensure the contact tracing, so we could isolate the potential cases and stop spreading the disease. So this was our part of the job. We were making epidemiological surveys and placing potentially infected people in isolation. Here are some photos of us during our training that we needed to pass so we could do the job properly. After that, I would like to speak about the medical students' assignments during this project. I would like to say that the project started in November 2020. It was planned to last 6 months and was divided into 3 phases. So every 2 months, 50 new students were volunteers at the public health centers, and they were volunteering mainly in the capital city because of the number of active COVID-19 cases, but also there were students who were participating in their hometown health center. Our job was doing the epidemiological service with confirmed positive cases via phone calls. We were tracing contacts who needed to be isolated. We were searching for the persons with whom the COVID-19 positive person had potentially high-risk contact. And also we were processing the collected data in Excel forms with appropriate digital tools and submitting daily reports. We were giving simple advices, such as take prescribed medication and contact your doctor if your symptoms gets worse. Next, here we have epidemiological survey, the example of the epidemiological survey, which contains personal information about the patient, some information about the clinical presentation, also patient medical history and comorbidities. This questionnaire also has questions regarding the traveling of the patient. Did the patient travel in the period of 14 days before onset of the symptoms, and where did he travel? Next, we have the contact tracing survey. The contact tracing survey is made to the possible infected person, and it contains questions regarding the contacts of the person with the positive patient. I would like to say, and I need to say this, that the process was not digitalized. So we did everything by hand, and it required more time, more people involved, and sometimes the same surveys were done twice to the same person. But at the beginning of this year of 2021, this process was digitalized, and it was connected to an application called My Appointment. So the student was entering the done service and they were sent directly to the national database. I would like to say that because of the ongoing situation and the growing problem with the healthcare system dealing with the increased number of COVID patients, led us to think how we, the students, could be an additional help to the health system. We offered to be included in COVID centers as volunteers with aim to facilitate with clinical care. And since we got accepted, we were evenly distributed in different departments who were all COVID crisis focused. There were exactly 50 students at COVID-19 centers as a support to the healthcare professionals. What was their job in specific? They were doing constant monitoring of heart rate, blood pressure, saturation of oxygen, and temperature of all hospitalized patients. They were regulating patient hospital discharge and admissions. We were reviewing diagnostic images and lab results, consulting with mentors and other doctors. Every student had a pulmonologist as a mentor, and 2 students are rotating each 8-hour shift every 2 weeks. Here, I would like to present the results up to 22nd of February 2021, because the 3rd phase of this project was still ongoing and the Congress had their deadline. Here we have 44 students who were divided into 2 groups. The first group of 26 students was located in Center of Public Health in Skopje, and their job was to do epidemiological surveys and ensure contact tracing. And the other group of 18 students were volunteering in Institute of Public Health, and they were, beside of these jobs, they were doing much more. They were putting the done service into Excel forms, and they were sending in directly to the national database. Each group was for 2-month tour, and 50 students also were volunteering at the same time at COVID-19 centers. So in 4 months' time, we had 73,056 newly confirmed cases, of which 9,070 active cases, or to be exact, 12.4% were done by the students, and 16,165 cases, or to be exact, 22.12% were entered into the national database. As we go on, as a summary, I would like to say that the 3rd phase of volunteering at the Institute and the Center for Public Health has just ended, but the results have not been presented yet, and volunteering at COVID centers continues. And I would like to say that we are not now getting involved in the process of mass immunization of the population as administrators and as needed to assist medical staff. We are very happy that we managed to help our fellow citizens and the state with our involvement in the struggle. And the numbers from the results do not speak for our help, but the gratitude of our citizens and the pride of our teachers and professors. As the last slide goes, I would like to say that we will never forget our citizens who lost the battle with this invisible enemy, and we express our gratitude to all healthcare workers. Better days are coming, we believe in that. Thank you for your attention.
Thank you, Ms. Tarminska, for
Thank you for having me.
Now we've finished the 2nd section. Thanks for all participants and audiences. We continue our program with the concert organized by our school. There will be a 15-minute break after the concert. Our new section will continue with the moderation of Dishat Akta at 14:20 in Turkey time. Thank you.